Hello, my name is Solange Valenzuela. My topic about is therapy for hepatitis C. Definition is an inflammation of the liver caused by the hepatitis C virus. The virus can cause both acute and chronic hepatitis, ranging in severity from a mild illness to a serious lifelong, if including liver cirrhosis and cancer.
So hepatitis C infection virus specifically attacks the liver altering hepatitis liver organisms. Most people who are exposed to hepatitis C system fails to years or so to go from the original infection to the development of complications such as cirrhosis and possibly even liver cancer. So now we're looking at patients who may have been exposed 20, 25 years ago, so in the 80s, have developed the complications of liver disease. We know specific risk factors such as intravenous drug use, blood transfusions before 1992, exposure to dialysis, use, HIV positive, children who are mothers of hepatitis C. If you have those risk factors, you need to be tested with that simple blood test. People have wondered about the role of tattoos. Actually, the tattoo industry has dramatically revised how they use ink itself, these disposable needles to try to reduce the risk. Folks have wondered about the role of piercings, the role of manicures and pedicures, just because hepatitis C is an infection that's transmitted from blood to blood. It doesn't have to necessarily be visible blood, it can be just a microscopic amount of blood, unfortunately, at the right time. It's somewhat stunning, but about 75% of people in the United States who have hepatitis C haven't yet been diagnosed. We've known about this infection for more than 20 years. I think there are many reasons to be hopeful that our treatment of hepatitis C is only going to get better as we go forward. On one hand, we're going to find out many more patients who have hepatitis C who don't currently know it. Another reason to be exceptionally hopeful is newer medications which will be available, like interferon-free regimen. Cure rates are fantastic, and patients only have to take it for a short period of time, so it's pretty easy to comply with the regimen. Very few side effects compared to prior hepatitis C treatments, so it looks like we're going to be curing a lot of patients with hepatitis C.
The application in medicine. The doctor must be informed of any condition or disease, but before the start of treatment and any modification that occurs during it. Surgical intervention, dental procedures, pregnancy. Likewise, the doctor must be informed of other drugs that might be received. Pros: reduce the possibility of contagion. Normals transaminase, reduce viral load, and finally stop the evolution of the design, avoiding the progressing to liver cirrhosis and liver cancer. Cons: this treatment is effective in less than half of the patient infection, with ACV phenotype, one the most common in North America.
You had a blood test called a hepatitis C antibody test, and the test has come back positive. This means the test found hepatitis C antibody in your blood. At some point, you come in contact with the hepatitis C virus. Hepatitis C is a virus that lives in the blood and can have serious effects on your liver, even causing cancer. Around 1/4 of people clear the hepatitis C virus on their own. Unfortunately, even if they do fight it off naturally, they can get it again if they put themselves at risk. There is no immunity to hepatitis C and no guarantee of being able to clear it a second time. Your doctor or health worker will have to do another test to see if you have the hepatitis C virus. This is called a PCR RNA test. If this test is positive, it means that you have the hepatitis C virus, and without treatment, it will be there for life. They will also discuss with you about when you think you may have contracted the virus.
So what will happen to me?
Most people living with hepatitis C don't feel sick for a long time, but slowly, over many years, they may get tired, run down, and unwell. This can make life a lot harder to live, and sometimes it's very serious, even deadly. The good news is there's now a very effective cure that you can get from your doctor. There are new treatments to cure hepatitis C, and around 95% of people on treatment will be cured. Just be aware, even if you clear it or it's cured, you can still take it again.
What is the treatment?
Most people, all it takes is one pill a day for 8 to 12 weeks and a few simple blood tests along the way. It's very important that you take your treatment every day until you complete the course. Unlike previous treatments, there are very few side effects. During treatment, your doctor or healthcare worker will do a blood test to see how you're going and if it seems to be working. After 8 to 12 weeks, you'll have finished your medication and you'll have another test which we hope will confirm your hepatitis C is gone. The doctor will want to see you again a few months after taking your last tablet. There will be another test called an SVR test. This is the most important blood test, as this is the one that tells us if you're cured. But remember, this is a cure, not a vaccination, so you can get hepatitis C again if you put yourself at risk. If you become reinfected, that does not exclude you from further treatment.
How do you get hepatitis C?
Hepatitis C is only passed on through blood-to-blood contact. Most everyday activities do not pass blood from one person to another. Just living, working, and being around people who have it is not a risk. The most common way of passing on blood is by sharing any equipment used for injecting drugs. And you can get it from using unsterilized tattoo and body piercing equipment, or sharing razors and toothbrushes and ceremonial tools. So basically, anything that passes infected blood from one person into another.
How do I stay healthy?
To make sure that you're cured, you must take the pills every day for the time your doctor says and have your blood tested when it's needed. Stay in contact with your doctor or healthcare worker. They're here to help you follow the treatment and answer any questions. Don't share anything that can pass infected blood from one person to another. And we all feel better when we eat well, exercise, and cut down on the grog. Your liver will thank you for it. You can always call the people at Hepatitis WA on these numbers. And remember, there's always care and support for you when you need it. You've had a blood test.
Jesus applied in Ecuador. A2 in Ecuador, this disease is of low incident. The necessary preventive measures are taken. There are still no vaccine to prevent infection by the hepatitis C virus. So, our invention plays a very important role in reducing the risk of contagion.
Come back. In this video, you will know when to choose hepatitis C and what medications we use. Before going to the treatment, these 4 points are very crucial and important. It's very unusual if not one of them appears in your exam. First, only acute hepatitis C infection benefits from the treatment. So we do not treat chronic hepatitis C. The prognosis is determined by the genotype of hepatitis C virus. Thirdly, once treatment is completed, the patient must be vaccinated against other hepatitis viruses. And finally, after the treatment is started, we have to assess the response by measuring hepatitis C virus RNA 3 and 6 months later. In a perfect patient, after 6 months, there will be complete eradication of the RNA. Take a screenshot of this or save it somewhere because it's very important. We have three main groups of medications that we can use. If you remember the first line, I remember very serious liver disease. So we give the patient sofosbuvir plus one of these medications. If you remember the second guideline, I remember outpatient department or OPD. So we give the patient omlitazvir plus partabravir plus dazabuvir. So 3 medications. And if all fails, we can go to the end game, which is the third guideline, in which case we give the patient ribasvir plus razobravir. Here's a small quiz. What is the mechanism of action of sofosbuvir? It's an RNA-dependent RNA polymerase inhibitor. All right, guys, that's all I have. Hopefully this helps, and thank you so much for watching.
Conclusion. Proper and time life management will also allow. Receive education again about options for managing your designs. Vaccination against hepatitis A and B to prevent simultaneous infection with this virus and avoid a greater impact on the liver. Periodical undergo tests to diagnose liver disease and our early stage. Thank you.